Gabriella, and I work as a psychotherapist treating patients with behavioral and emotional issues. Psychotherapy uses applied psychology to treat patients suffering from behavioral disorders or emotional trauma. I have a small private clinic near the Parkland Hospital, so most of my patients are referred to my clinic from the hospital. My office is a room where patients can sit anywhere they want and feel the most comfortable they can open up. Psychotherapy has proven to be effective in the treatment of many types of psychological symptoms, and the disorder I would like to address is known as PTSD, post-traumatic stress disorder. This disorder is caused by the consequences of experiencing extreme stressors or trauma, such as military combat, sexual or physical assault, suffering from any acute conditions, such as anxiety or paranoia. I have seen this disorder very common among veterans or those that have joined the Army. Main symptoms can be repeated re-experiences of the trauma through images, thoughts, nightmares, or flashbacks. Another symptom is persistent avoidance of situations, and treatment for each patient is very different depending on how serious the trauma affected them. For most patients, cognitive and behavioral therapy have worked very well and has proven effective to the treatment of PTSD. And a major element of the therapy is systematic desensitization. For a couple of months now, I have been seeing a patient that was diagnosed with PTSD, a young Caucasian man who is only 24 years old and that had joined the Army at age 19. He was deployed to Iraq, where he witnessed many traumatic events, and he was referred to me after he recently was admitted to the hospital for attempting suicide. Since he's been back from the war, he has had a normal life. He gets into many violent fights, consistently hypervigilant to any threats, and when walking around through crowded places, he can be very paranoid. I've recommended some medication to help him sleep and with his anxiety. I've also recommended him to treatment of behavioral therapy with a group of other veterans that may have also suffered from PTSD. PTSD is a very common disorder that many people do not see as a major psychological problem, but with all the traumatic events that have been happening around the world, I think it is our responsibility as health professionals to promote education on these types of disorders to colleges and schools. Health professionals treating patients with PTSD should remember that many of the patients do not want to talk about the traumatic event that they experience, so try many different strategies to open them up. Also, a major problem with this disorder is that many people may describe them with medication to solve their problem, but it is our responsibility to make sure that they get the right treatment they need and that they get taken care of well. Thank you.